Hi friends, today through this video blog I am going to talk about a common problem, a swelling which is present in a lot of individuals. We are generally concerned whenever we get a swelling whether this is a cancer or not. So today I will throw some insight and give you some clarity. So the two common swellings which we see in the skin and subcutaneous level are the sebaceous cyst and the lipoma. Lipoma also referred to as a fat swelling. So the sebaceous cyst is nothing but in our skin there are billions of sweat glands which are situated. So when there is a destruction of one pathway or if there is a blockage in the pathway due to some infection, then the sweat and the sebum which is originated in the sweat glands gets accumulated and slowly it becomes a small swelling. And very characteristic of this swelling is a black dot like structure which is present in the swelling, and this is called as the punctum. So only a sebaceous cyst has this particular feature. In addition to it, generally the sebaceous cyst can become bigger in size and it is not harmful and it does not turn into a cancer. When we come to a lipoma, generally the problem associated with lipoma is certain individuals have only 1 or 2, 3 lipomas, but some of them have a tendency to have multiple small lipomas either in their back or in their arms. This is called as multiple lipomatosis. The cause for why this lipoma comes is not very clear right now, and we also know that there is a genetic predisposition for this. So both these swellings generally don't turn into any fearful cancers. The only complication which can arise of these two swellings are: one, the sebaceous cyst has a tendency to get infected. If at all the cyst gets infected, only then it turns painful. In addition to the pain, the patient might be able to observe the whole area become slightly more swollen. If you touch it, it will be warm like it's running a temperature, and sometimes when it's very badly infected, you can have some pus or white paste like discharge through the small black like punctum. The lipomas generally tend to get only bigger in size, so when they are very big they can cause some pain, but other than that they do not undergo any complications per se. So both these tests are a clinical diagnosis and you do not need any special investigations to diagnose them. If you go to a doctor, they will be able to diagnose it and tell it to you what swelling it is. Neither of this swelling can be treated with any medicines. In a very rare case, if the lipoma is situated in a deeper area like the thigh or in the abdomen, we might have to do a bigger investigation like a CT scan or an MRI to confirm that it is only a benign swelling and not a cancer. And when we come up to the treatment options for these swellings, the only two options we have are to perform a surgery and remove the swelling completely. So this is a very minor procedure where we give some local anesthesia around the swelling and we do a surgery and remove the swelling entirely and send it for a histopathology to confirm it is a benign swelling. After that, the patient in a couple of hours he will be good to get home, discharged from the hospital. So this is called as a daycare procedure. I hope this has clarified your doubts and common questions you would have regarding these swellings. If you have any more doubts, you can contact me at Ashwin Hospital. Thank you very much.